Hello, I'm Dr. Shalisha Wesley, consultant, obstetrician and gynecologist and fertility specialist. Today we are going to talk about an important topic, that is thyroid disorders and how they affect your fertility. So nowadays disorders are unfortunately becoming increasingly common, with about 5% of the world's population suffering from hypothyroidism. It is also said that an additional 5% of population remains undiagnosed. In India, 1 in 10 people suffer from hypothyroidism. So it is very likely that either you or someone you know might have been diagnosed with hypothyroidism. So let us now discuss about these thyroid disorders. Are all thyroid disorders the same? Absolutely not. There are two broadly divided. There are two kinds of thyroid disorders. One is hypothyroidism, where the thyroid gland secretes less of the thyroid hormone, and the other one is hyperthyroidism, where the thyroid gland secretes more of the thyroid hormones. So, how will you know if you have a thyroid problem? Today, let's concentrate more on hypothyroidism, because hypothyroidism is more common than hyperthyroidism. So, what are the common symptoms you will have if you have hypothyroidism? One of the most important symptoms is unexplained weight gain. So, patients will come to us and say that we're not eating much, doctor. My appetite is also less, but somehow I seem to be putting on weight. Another important symptom is fatigue. So patient complains of feeling tired all the time, lethargic. They feel sleepy during the daytime, even though they've had a good night's rest. Other symptoms can be hair loss, dry skin, constipation, and also you can have menstrual irregularities, you can have irregular cycles, and it can be difficult to conceive. So many of these symptoms might seem generic. So if the moment you realize that you have one or more of these symptoms, it is not wise to rush into thinking that you have hypothyroidism, but it is always better to check, to have a lab test. So now we come to the point where we find out how to diagnose thyroid disorders. So thyroid disorders can be diagnosed by a simple blood test. It's just a simple blood test. It is preferable to give it in fasting, but you can give it at any other time of the day also. So it is a blood test. In that blood test, mainly they see the levels of three different hormones. So there is FT3, FT4, and TSH. Many doctors, they prefer to even just give TSH hormone alone, and if that TSH hormone is abnormal, then they will proceed to give FT3 and FT4. But it is advisable to give all three at the same time. So if the TSH value is higher and the FT3 and the FT4 values are lower, that means you have a hypothyroidism. That means the thyroid level is less in your body. On the other hand, if your TSH is very low and FT3 and FT4 are high, it means that you have a hyperthyroidism. Then how do you treat it? It is very simple. To treat hypothyroidism, you just need to take the replacement of the thyroid hormone. So when the body is secreting less of the hormone, you're just giving it from outside and supplementing your body's hormone with the hormone which you're giving from outside. So you can give a tablet that is called levothyroxine. Now the main thing about this tablet is that you need to take it regularly, and also that you have to take it before food. So you have to take it on an empty stomach the first thing in the morning, and only after half an hour of taking this tablet you can consume tea, coffee, or any other beverage or any other foods. And it is advisable not to take this tablet along with any other tablet, because it interferes with the absorption of this hormone. You need to take it regularly, as I said before. Some people, they say that I took it for 3 months or 6 months and then I stopped taking this tablet, but that is not at all advisable. You need to take this daily and continuously. That is when you will have a good result. And then when do you again check it? Suppose today you've been diagnosed with hypothyroidism. When is the next time you need to check your thyroid hormone levels? Usually people check it after 6 to 8 weeks for the first time. And once it is found that your body is having an adequate replacement of this thyroid hormone, it is enough to check it once every 6 months. So now just before I close, I would like to deal with some of the frequently asked questions about hypothyroidism. I asked a few of my patients to give me, the questions they would have liked to ask me, and these are some of the questions which they came up with. So the first question is, should I take my thyroid hormone lifelong? In most of the cases, yes, you might have to take it lifelong. Remember, it is just a small tablet, and if it is taken daily, the effects on your daily life are very good. So it is advisable to take this tablet lifelong. In some cases, when you check, it is found that your thyroid levels have normalized, or they have fallen, the TSH levels have fallen quite low. In such cases, the doctors can advise you to stop the medication, and but it should only be stopped at the advice of the doctor. One of the other questions that my patients had given me is, are there any side effects of this thyroid medicine? If you take it in the correct dose that is prescribed by your doctor, usually there are no side effects for this thyroid medicine. However, if you have taken extra medicine by mistake, then you might have some palpitations, and you might have pounding of the heart, or increased pulse rate, or increased BP. But as I said, these complications are very rare if they are taken in the correct dose prescribed by the doctor. Another important question that many patients ask is that, will this thyroid problem affect my baby? uh, Yes, because if you do not take your tablets correctly during pregnancy, some people think that once they become pregnant, it is not necessary to take these tablets. But it is important to know that in the first 3 months of your pregnancy, your baby is not producing thyroid hormone on its own. And so the hormone that is in your body is what is supplying this thyroid hormone to the baby. So it is very essential to take the dose which is prescribed by the doctor correctly, even during pregnancy. And so that's all about thyroid disorders. If you have any other doubts, feel free to let us know. And we're always here to help you. The main thing is that don't panic if you have been diagnosed to have a thyroid disorder. It is a very minor problem, and it is very treatable with all the medicines available now. In fact, I would like to say that about any problem that you have been diagnosed with in your infertility journey, almost all problems are treatable because nowadays technology has advanced to that level. So, whatever the diagnosis that has been told to you, don't be worried, don't be anxious about it, but consult your doctor, listen carefully to what they say. And if you follow their treatment, definitely you will succeed in this desire to have a child. So, thank you.